think we can jump into our discussion among different countries, different experiences, different degrees of maturity of the nursing roles, I would say. And I'd love to start out with a more general question. What do you, or what does each of you think makes the role, or it could be the advanced practice nurse, could be community health nurse, what is special about the development in your country, specifically? Would you like to start, Steph?
Yeah, of course. Can you hear me? Yeah. I think for a long time, community nursing hasn't really been recognised for what it is in the UK. I think we're at a point now, the 10-year plan that I showed you gives us a real opportunity to take this forward. I personally believe, having been a community nurse for a long time, it's an absolute privilege to look after somebody in either their own home or their own community. And I think we've got to get that through to people more. So I think we need to stop admitting people unnecessarily into hospital. Martin made the point, too many hospitals in Germany, exactly the same in the UK, far too many hospitals. I know we need hospitals for certain things. I think the other thing is we admit too many people who are frail, elderly, with comorbidities who end up never coming out of hospital. And that's, I don't mean they come out of hospital, but they go into long-term care rather than into their own homes. So I want to see more investment in the community so we can keep more people at home.
Okay. Yep. And I think, as you said, the UK is already providing excellent examples what could be done and how it could be expanded. Juli.
Yeah.
What do you think? What makes it special, the APN, in your country?
I think that the most special thing is now that the doctors are believing that that's the thing that can help patients.
That is very interesting.
Yeah.
How did you get that job done?
I didn't say that all doctors, but the number is getting higher and higher all the time because they have been working together with the APN, or they have more likely to hear what the APNs can do. So the community is getting bigger who is believing.
So the evidence is there.
Actually, the scientific evidence we don't have yet.
No, practical
but
evidence can also
evidence
be
we have.
Yeah.
But about the data, we don't have the data to prove like you do, or you will be having that data. But we don't have that step taken yet.
Okay.
So,
but you're getting there.
Definitely.
But I think it's super interesting that you get, or you start to get the buy-in. Because that is, I mean, I guess it's part of communication work, it's part of a good collaboration. You see good outcomes, you start believing in it.
Yeah, because we started the intensive work in 2017, and we started to put down the messages that we wanted to communicate to the patients, to the APNs, to the doctors, and etc., to the politicians. And we sticked on that. And we repeated the messages all the time. We didn't change it, just to put another language, because patient needs to understand and they need one language and the doctors need another one. And the very good selling point to the doctors is let the APN work to the scope of their practice, because then you, the doctors, have free time to take on the really severe cases. And it sells.
Very good. So thanks for highlighting the importance of a good marketing and communication in this whole process. But it's what you described is exactly what they did in France in these pilot regions. Very similar. It's really the communication strategy and involving people and talking to their ego as well. Yeah, so they can look at the really interesting stuff. Marta, what makes it special in your country, the role of the nurse?
Well, I think in our country, people start realizing our strength, our compromise, we are very compromised with community, and we feel a part of it, we are a part of it, and in everyday lives. In Santa Maria, for example, Martin, you know, people stop us and ask for something, or there's a question when you go to the street, and Martin says, oh, everybody knows you. Yes, of course. I'm
so you're accessible.
Community. Yeah, we try to be. And by the way, I think I'm surprised and not surprised, because I think we are facing the same challenges, although we are in different cultural contexts and health systems. We have problem with data. Maybe because care is not always tangible, and it's difficult to measure, but we know there can be ways of doing this. So nurses must be there in every decision space to participate in decision making. And in Spain, it's starting.
And is it, I mean, it reminds me also, again, a lot of the French example. Is it also because of the Spanish culture? Or do you think it is more a very local thing in your community, that this is happening because you push things forward and people interact anyway, or is it?
Well, interaction is part of Mediterranean lifestyle.
That's exactly what I thought. Yeah, it's the same. Yeah.
I think you were shocked sometimes by the way we...
Shocked? How that?
We communicate.
Humbling all the time, yeah.
Oh, okay. Well, and yes, I think it's a part, it's cultural,
yeah.
But we're trying to...
It's also strategic, right?
Yes, of course.
So you're leveraging what you have in terms of the culture to make something even better.
Kind of.
Okay, good. Martin, what makes it special in Germany?
I think we have a good basis, because on the operational floor, in the connection between nursing and general practitioners, I've seen many good practices. I see there's a very good connection. We have problems on the political area, but not on the basis. So let's have a look.
So we need bottom up. Okay, we don't have as much time as I would love to. It's half of the time is already gone, because I'd love to talk with you about the roles and the authorization, what you can do, what you can't do, etc. But we would love to learn something here from all of you, and especially for the next panel and the discussion this afternoon. We'd love to get, some information on which were the drivers of this development in your respective countries. Why did this start? Why did you start creating these roles? And also, who was kind of pulling the brakes? Who was the biggest problem in the whole process? And then, of course, if we still have time, what did you do with that one? How did you get it done? Do you want to start again, Steph?
Yeah, okay. So if I think about advanced practice in the UK, because I think that's probably the context here, I think it was the mid-90s, so a lot of the work that happened in the UK came from America. In fact, Dr. Barbara Stillwell, people may have read her work. If you haven't, I would recommend you do. Barbara is a UK nurse who went to America and trained as a nurse practitioner over there, and then brought back the education programme into the UK. So I think the driver at the time was actually a lack of medical roles, and we needed something to replace those medical roles. And I know we've talked about the nurse practitioner and advanced nurse practitioners not doing that, but I think that was the original driver. I think those of us that are advanced practitioners are really clear. I'm not a doctor. If I'd wanted to be a doctor, I would have gone and trained as a doctor. I think the driver now is that holistic approach to patient care. The fact that as a nurse we understand all the different systems, and actually I think as nurses working in the community, we call them in the UK super connectors. We know everybody. At Marta's point about that communication and knowing where to go, where to get that help for your patient, because it isn't always medical help that you need. Sometimes it's the faith group, it might be the church group that actually you need to help with isolation, loneliness, those types of things. So I think the driver was a gap in the medical workforce. There is no longer a gap in the medical workforce in the UK. We've gone the other way, where there are now not enough jobs for medics training in the UK, so it's become a problem, and nurse practitioners are now seen as a bit of a threat in the UK. So we've come full circle. I think what we've got to do in the UK now is prove that we're not in it to take over doctors' roles, but that actually we enhance the whole experience for the patients.
Excellent. What's happened? How did it happen in Estonia?
I think that one of the triggers were the independence that we gained again, because Estonia was occupied by Russia 50 years, and beginning of the 90s we gained our independence, and first thing that we did was the nurses curriculum, and the second thing was that the doctors thought that we need a specialized nurses as well. They bring some courses alive, and doctors were the teachers, and this didn't, we didn't as a union or as an association didn't like that, because we thought that the nurses should teach nursing. And so there were a big group initiators whose decision was that we need for specialization. And that was the trigger. After that, next 10, 15 years, it was quite good, but the development stopped because of the political will and because the doctors were against it. And when we came as a president and vice president in 2017, I was educated as APN, and I believed to the advanced practice nursing. And one thing that I wanted to achieve was the APN should be legalized, and we did it.
And why were they against it?
Because they are afraid, at least they were in Estonia afraid, that we will take their jobs and all that, and the money comes from their pockets to our pockets. But no, that's not the case. We don't want to be a doctor, so yeah.
Okay, great, thank you. What makes it special?
I think, well, I could repeat the same. In Spain, I think to be a 4-year degree since the Bologna process has made a change in nursing education, because now it's easier to access to a master and to a PhD. Before that, if you were a nurse, you could study another degree, and then maybe anthropology, and then you could do a PhD. So nowadays, it's easier. So we have more nurses with experience in research field and so on. And also nowadays specialty are more implemented. It has been very difficult. You know, I told you, we've spent a lot of years trying to implement it, but nowadays we are, I think, enough to push things and move the situation to where we want to be.
Anybody who put the brakes on?
Anybody.
Or anything? Any opponents?
Opponents, of course. There are. I don't want to mention doctors again, but it's not a question of every single doctor or person who is doctor. It's about medical unions and so some kind of this stuff. Okay. But, you know,
but you made it.
We might.
You made it. All right. Martin.
Drivers for change. Actually, yeah, I think we have some heroes in nursing. For example, some community health nurses who work for the topic. That's great, I think. We have some general practitioners I know who work for the topic of community health nursing. I think that's great too. And the biggest topic, I think, is hospitals dying. So now we have to think about what we could do with all the nurses. It's a good moment.
And what's the biggest impediment?
I really don't know how to say in English. Ich denke, wir sind nicht aufzuhalten. Vielleicht so.
Nobody can stop it.
Yeah.
All right. So we'll do the Queen song, "Don't Stop Me Now," right? That's for the after show. Okay, I'd love to turn it to the audience. Questions for our distinguished panel from your side. We have just 3 minutes left. Afterwards, there's coffee, but you need to earn it. So please, yes. There's one question there and another one over there.
Ich spreche mal in Deutsch. Ich glaub,
Alles gut, ich übersetze.
Die Frage, in Deutschland haben wir jetzt in den letzten Jahren doch Zuwächse an Ausbildungsplätzen. Das heißt, wir haben mehr junge Menschen, die in die Ausbildung reingehen und sich natürlich auch entwickeln wollen. Und auf der anderen Seite ist die finanzielle und politische Situation gerade besonders schwierig. Krankenhäuser werden eben zumachen, Menschen werden im System erstmal freigesetzt werden und sie gehen nicht genau dahin, wo wir sie vielleicht am Ende brauchen. Wie ist das in den anderen Ländern? Ist die Nachfrage nach eben dem Beruf Nurse groß und wie ist da die Situation generell beim Nachwuchs? Ja.
Okay. So the general question is really about the demand for the nursing profession. Are young people interested in this, in becoming a nurse? And also with relation or in a relationship to the other settings, right? Is there a trade-off? How is it? How does the future look for this? Since we're now all putting so much work into it, we need to make sure that it's actually interesting.
So demand for nurse training in the UK has gone down. We don't see as many people applying to come into nursing, so that is a problem. There's a big drive at the moment to try and help with that. The workforce in hospitals has gone up while the workforce in communities has gone down, and that needs to be reversed. And I will just say this, it's a little bit controversial when I say this in England, but we train nurses to work in hospitals. We do not train them at their pre-registration training. We don't train them to work in the community. I think if we did and they understood that and they knew the job, I think we would recruit more nurses.
Mm-hmm. Mm-hmm. Okay. How is the situation?
Estonia is situation very good. Just one period of applying to the position, the nursing student position was just ended, and it was 5 applications to the 1 seat, so it's good, looking good now. But in the future, we don't know, because right now we see that the younger people getting less and less interested in healthcare, and the age of the students is getting higher, so they are coming to the nursing with the second choice more often. So.
Interesting. Marta.
Well, in this case, in Spain, it's not the same. Health professions are very, very demanded, and also nursing. Many students want to be a nurse. Some of them choose nursing studies because they couldn't study medicine, it's true. But still, many young students want to be a nurse. But the perspective has changed because they are more exigent with working conditions. I don't know if it's the same in the rest of the countries, but maybe it's not as bad as I think. But, well, it has changed their perspective and the way we communicate in the teams.
Excellent. Martin. What's your perspective?
It's okay, I'm from Germany. Mrs. Lux is right. We have an increasing number of the youngest post-pandemic, I think. And yeah, we cannot do more, actually. We have 60 educational nurses. So.
Okay, excellent, but very different perspectives. And it might also be interesting for the next generation to think about maybe moving to Spain for some time, enjoy the Mediterranean culture, to learn since the function is already established, and then come back to Germany and jump right in. So anyway, lots of opportunities. If you had the magic, if you could do magic, what would be your first priority to tackle? Just one sentence, one priority that you would take on right away.
Investment in community nursing.
Well, I think it's the same, because we are lacking the finances and resources and the positions and etc. So the same.
Thank you. Marta?
I couldn't agree more. So I'll say the same, invest community health nurse, and also invest in primary care, because we don't work alone. We need to be more and stronger.
Context. Very good.
Okay, that's easy. Yeah, just invest and with an attach, do it sustainable. Yeah.
Excellent. Thank you so much for all your valuable perspectives. And with that, I think we deserve a little coffee, some caffeine to be ready and up for the next and last part of the day. Thank you.